What if you did not have to relive a difficult experience in order to heal it? I know it sounds too good to be true. I actually thought it was too. But I am here to say that there are ways of processing really difficult events and traumatic events that do not require you exposing yourself to all of the painful feelings about it or to talking about it constantly. I know it sounds impossible, but today on the Holistic Therapy Revolution, I'm going to talk to you about this tool and tell you how it works and why it works so that you can see if it might be right for you or something you want to learn. So one of the biggest fears that people have about trauma healing or healing difficult things that have happened, they don't even have to be traumatic, is that they have to go back into it and that they have to relive it all and that they have to talk about it a lot. And for many people, that alone keeps them stuck because they're avoiding exposing themselves to that pain, or they've already exposed themselves to it, 1,000 times in 50 conversations or with 100 therapists, and there's really no resolution. It has not been resolved through talk alone. And so they are not motivated to keep doing that, which sounds like it's pretty understandable. So because the truth is that some memories do feel too painful or too overwhelming or too intense to revisit directly, or when we do, it makes us dysfunctional or it activates anger and frustration that then we carry into our world, and that doesn't feel like healing. That feels like I just got activated again and I'm out of control again, or I feel depressed again, or I feel sad about this again, or I feel anxious about this again, and it didn't do me any good. And so we can understand why people would just want to avoid those things. So what if you could actually resolve some of those things that have happened without fully activating it all? It just sounds like a miracle, and I'm willing to bet you might say it's a miracle at the end of this too. So that's exactly what we're talking about today. So welcome back to the Holistic Therapy Revolution. I'm Beth Miller. I've been a holistic therapist for over 25 years. I am the creator of the Advanced Holistic Counseling and Coaching model and also the certification program. So if you're a therapist or a coach or a healer that wants to learn how to integrate the most powerful, ethical, and holistic trauma tools that come from both traditional psychotherapy and hundreds of different tools from different modalities into one system that makes you a holistic therapist, where you're really doing that great healing and thriving work with clients, then the link is below. Go ahead and check that out. So let's talk about the FLASH technique. So FLASH technique is a trauma processing method that was originally developed within the framework of EMDR. It is designed to help people process disturbing memories. Now, if you don't know what EMDR is, it stands for eye movement desensitization and reprocessing. I've been an EMDR therapist for about 25 years. And when I learned EMDR, we did not have the FLASH technique. It's something that's come about since then, and it's an extraordinary addition. It can be used separate from EMDR. It does not require using EMDR, or it can be used in conjunction. And I have done both of those, and they both are really effective. And this technique, FLASH, is designed to help people process disturbing memories or resolve them without having to consciously focus on them. Just let that sink in. Just let that sink in. Like, modern techniques like this are extraordinary and we need them. So thank you to folks that have developed them. Now, unlike traditional approaches where you might need to talk through the memory or feel into it, and there's nothing wrong with that. That's certainly an okay approach. The FLASH technique allows the brain to process it in the background. So up front, you're doing something different. In the background, it's getting processed. This makes it gentler, less overwhelming, and often a lot faster. Now, here's why the FLASH technique works. The brain has a natural ability to heal and process information, which is awesome. But trauma interrupts this process. instead of being fully processed, the memory gets stuck in the nervous system. The flash technique works by keeping the nervous system in a regulated, resourced state. Resourced means skilled or calm or where we have good coping. It keeps that nervous system in that state, reducing the intensity of the traumatic memory, but also allowing the brain to reprocess it without overwhelm. I know, you're still probably not a believer, and I'm with you. I mean, if I didn't do this all day with people, I wouldn't believe it either. So flash is essentially telling the brain, you're safe enough now to process this. And because the person is not fully activating the trauma or the challenge or the painful memory, the system does not go into fight, flight, or freeze. Now, this is used in trauma therapy and also just for challenging circumstances and hard memories and hard events, because not everything that's hard is traumatic. And I think it's important that we say that over and over again. Trauma is a particular set of conditions, but we all have experienced hard things, even if they're not traumatic, and they disrupt us. They're difficult for us. They're painful for us. So the flash technique is especially helpful when the trauma or the challenging experience feels too overwhelming to talk about, when the person avoids the memory entirely, when traditional processing feels too intense, or when there's a high level of emotional activation. And I'm going to add in another thing here, when talking about it hasn't solved it. And I know firsthand that there are things that I've talked about ad nauseum that do not get solved by talking about them. I might make connections, I might have new insight, but I am not relieved of it for any long-standing swath of time, which tells me it's not resolved, it's not integrated. But flash is really good at that. So flash creates a bridge between avoidance and full processing in kind of like a gentle way. Flash is also not just a great tool for trauma and for really difficult circumstances or things that have not moved from just talking about it, but also flash technique is really great holistic tool. It's deeply aligned with holistic healing because it works with the whole body, with the nervous system, with subconscious processing, with emotion regulation, with the brain's natural ability to be able to heal and having the capacity to be able to reprocess things. And also it respects something really important, which is the body and the mind need to feel safe in order to heal. Very often in therapy, trauma processing or doing that work is interrupted by how dysfunctional we can become when we get activated. So let's say I'm working with somebody and I'm not using flash and I just create like a trauma inventory with them. Tell me the things that happened, some of the things that you've experienced, and then we will have a sense of what we're going to be working on. Just that inventory can create a type of activation that can make somebody go home and lay in bed for 3 days. So we want, when we're doing this work about difficult things or about trauma or just about the hard stuff in life, we always need to remember that the person feeling safe physically and mentally and emotionally, or their whole being, has to feel safe enough in order to be able to engage in the work. And that's, a big part of the therapist's job is to ensure that. So this is why flash fits so beautifully into the holistic model and the holistic work that I do and that I train therapists in, is because it integrates mind, body, and internal processing. Now, I'm going to give you a couple of examples of how flash works and why it works, real client examples of how I've seen the impact of it. Flash essentially works like this. You ask the person to bring to mind the difficult issue that they would like to resolve or feel better about. When they do, you can say, you don't even need to tell me about it. I don't need to know the details of it, which is amazing in itself. People are so used to having to tell all the details in therapy that it's like, what? You don't need me to tell the details? And it's not necessary for flash. And then what happens next is that you ask the person to identify the emotions that they feel. about this issue and to rate it, which is similar to EMDR. And then from there, we do the technique of flash. We ask them to put the difficult thing on the side. Just put it over there. And we ask them to think of a very positive event, a positive visual, something that has happened in the past or that they imagine would be really lovely. It could be a made-up fantasy of going to Fiji, or it could be the time you actually went to Fiji, either one. And we ask them to focus on that, and then we do counting. And that counting is paired with a blinking or a squeezing of the eyes when the therapist has flashed. And what happens is that process that's done over and over again, and typically towards the end of a flash session or during it, the client is going to start saying things like this. I can't pull it up anymore. I can't think of the bad memory anymore. I can't access it. It's like it's gone. It's further away. It's changed. It doesn't have so much pull on me. I know it happened, but I can't grab it. I can't think of it. I can't envision it. And those are all signs that flash is working and that the person has been able to stay calm and relatively safe while the brain is doing the work behind the scenes. Meaning in one session, you could come to full completion on a difficult issue inside of a 50-minute session, no problem. And if you cannot come to full completion, you may make big headway in that 50-minute session and then in your next session complete it or get closer to completing it because flash works pretty rapidly. So let me give you a couple of examples so that you can understand what kinds of events I'm talking about here that I use flash on. So I've used flash technique with clients that had, let's say, very painful social experiences when they were younger. Maybe they were bullied. Maybe they didn't fit in. Maybe they got rejected at the lunch table. Maybe they were beaten up by somebody. And these are events that happen to a lot of people. And as people get older, they're kind of expected to just grow out of it. But a lot of times we carry it with us. And those events are painful, they're humiliating, maybe they were degrading, and it may have an imprint of limiting beliefs about ourselves. People don't like me, I don't fit in, or I'm unsafe to be around other people, I'm unsafe to be in crowds of people or to make friends even. And these experiences stay in their system and later can show up as social anxiety or a hyper fear of judgment or self-consciousness. And using the flash technique, when I use this with clients that have had these experiences, what I usually see is that we're able to reduce the emotional charge of these memories without forcing them to relive the experience or try to reframe it or try to understand it or try to find some way to make meaning out of it. But instead, the memories themselves soften and the clients report, I can't remember it anymore, or it doesn't feel powerful, or it's changed and it's different. It doesn't feel there anymore. It's faded. It's vague. And then therefore, their anxiety begins to shift in real world, in real time. And perhaps their ability to be able to socialize has been completely shifted because we have shifted those events from the past. We've reprocessed them. We've moved them. Other examples is that I've used these techniques in conjunction with EMDR, which is where flash originally originated. With, for example, if I have a client that had trauma like the death of a child or a significant accident or a deeply overwhelming life event, then I might use flash in the beginning to take some of the powerful charge and emotions out enough just to soften it just enough that the person can do EMDR. It takes some of the intensity out so then we can use EMDR to bring them to full resolution on it. But if they are unable to even do EMDR because it is too activating, it's too painful, flash can be a way of either being able to do EMDR or making the process of therapy much less painful for them. Because who wants to be in pain every time they come to therapy, right? It sometimes feels counterintuitive to people. So the flash technique can allow the process of trauma processing to happen gently, gradually, and safely. And then also, I'm thinking about some clients that I've used Flash. For example, if you've had a partner that did something painful to you in the past, or maybe it's a current partner that now it's impacted either your current relationship or maybe it impacts your fears about what can happen in relationship. Maybe you had a boyfriend cheat on you with your best friend for 3 years when you were 18, and now it's hard for you to go on dating apps. Or perhaps just last year found out that there was some infidelity in your relationship, and it's hard for you to sleep in the same bed with them or to forgive them even though you may want to, or to be able to be around them without getting triggered constantly. So we might use Flash as one of the techniques in order to be able to shift or resolve that. That has nothing to do with what happens in the relationship. In the relationship, you may need to do work related to what happened in the relationship, but we're talking about the individual's experience with being pummeled by painful memories and getting triggered often because of what's happened. And Flash can do just an extraordinary job on resolving that and neutralizing that so that that's not the burden that you carry anymore. So using the Flash technique in experiences like that, we're reducing the emotional intensity, we're shifting the internal response, we're helping the person to be able to move forward. Now, what makes Flash different is that it does not force the system. There's nothing forced. It is a very gentle process. It's working with the brain and with sort of the wisdom and the capability of the brain instead of pushing up against it or just activating it and then leaving us in that really dysregulated state. And that is a really key principle in all healing, but certainly in trauma healing as well. So this technique, by the way, should be done by trained professionals, people that really understand it, because they also have to understand the trauma underneath things. It's best if it's done by people that really have like good training in it. I would always recommend that, because even though it's gentle, it's still working with really deep material. So if Flash speaks to you, it may be something you want to learn, but it also may be something that you want to seek out in a therapist. You may want to look for a therapist that has that training, that knows how to do that if you're particularly interested in it. I consider Flash to be an incredible addition to the advanced holistic counseling model, and also to all of the work that I do, the therapists that work in my team do, and that we will train people in the advanced holistic counseling model, because it is so effective and so respectful of the person's experience and so efficient. And that's what we're going for with this whole being process that is holistic therapy. Thank you so much for your curiosity, for being here, for wanting to learn and expand your own toolbox, whether you're just a self-growth seeker or you're a therapist, you're a coach, you're a healer, where you want to expand your toolbox to be able to align mind, body, and soul that go way beyond insight alone, because sometimes and often insight is not enough. Until next time, I look forward to seeing you at the Holistic Therapy Revolution.